These are the 6 questions which I believe everyone who wants to immediately convert their rank into a postgraduate seat should consider. Question number 2. Should they go for MDMS or should they go for DNB?
Now that you have decided to convert your rank into a seat in this very attempt, you are faced with a choice. Should you pursue an MD or an MS or a DNB degree to complete your specialization in the subject that you have chosen to specialize in? I am 100% certain that in the era of hyperconnectivity and knowledge being easily accessible, you are well aware of the differences between MD, MS, and DNB. But just for the purpose of clarity and for those who may be a little bit on the fence, I am going to present 5 points in favor of MD or MS and 5 points in favor of DNB. And at the end of this video, I'm going to tell you a very simple technique which you can easily follow and come to a decision that hopefully you will not regret for the rest of your life. So stay tuned. Let's talk about the 5 things that makes MD or MS more preferable to DNB in the minds of people deciding to begin their post-graduation journey. I asked some of my students, all of whom are pursuing MS, that why did they not pursue DNB? And all of them uniformly said, first thing that came to their mind was it is very difficult to pass DNB. This is a reality. Of course, passing rates have improved dramatically in DNB, and in some very good institutes, DNB can have almost 100% pass rate also. But historically speaking, and even today, if you analyze both exams, the MD MS final university exam with the DNB final exam, the standard of the exam is more challenging when it comes to DNB. Why is it the case? More difficult questions are not asked in DNB. More advanced knowledge is not tested in DNB. And it is also not the case that smarter candidates pursue MDMS and less smart candidates pursue DNB. That's not the case. The reason why DNB has a low pass rate or a lower pass rate is because DNB exams generally are not held in the home center. When the exam is not held in the home center, the examinees travel to a different place where they meet examiners who don't know them and who have no sense of judging the examinee beyond the questions they are going to ask them in that moment. In the case of MDMS, you have worked in a department for about 3 years, and in those 3 years, the people in the department have figured out what kind of a student, what kind of a doctor you are, and that overall impression that you have created over a period of 3 years does play a very important role in deciding whether you pass the MDMS exam or not. That role is missing completely in DNB final exams because you are literally in front of strangers, which, if you make a very dispassionate argument, that makes DNB much more fair, much more reputable in my opinion. But it also does not change the fact that it becomes that much more difficult to pass the final exam. And I have known people who have appeared in DNB final exams not just twice but also thrice, and there can be more than that as well. So there is always this fear in the minds of candidates, in the minds of aspiring postgraduate doctors, that they might get into a vicious circle of constantly appearing in DNB final exams and their career might get stalled at worst and delayed at best. So that is one of the main reasons why MD/MS is preferred to DNB. The second reason why MD or MS is preferred to DNB is that MD or MS has wider name recognition, especially in the non-medical community. Certainly, people who have appeared in NEET PG, got a good rank in NEET PG, they are well aware of what is MDMS, what is DNB. But a patient might not be aware. A non-medical administrator in a small hospital may not be aware of the difference between MD or MS or DNB. Although, again, with the advances in the internet technology, people are becoming more and more aware. But generally, I feel even now, the awareness of what is the difference between DNB and MDMS is not as widely known as it should be. So there is a possibility and a source of irritation for the person having a DNB degree, where they might have to explain what DNB is. Maybe a harmless question may be asked by somebody who hears it for the first time. Is it same as MD or MS? Or is there any difference between the two? That may be a harmless question. The person asking the question might not have any malified intent, but if you have to answer that question over a period of years, decades, it gets irritating. And I know this because when I was pursuing MBBS, many of my well-wishers from the non-medical community would ask me, which subject are you specializing in? And I had to explain that MBBS is not where we specialize. We are taught everything, and then we have to do post-graduation, and that is about an entrance exam where we get a rank, and that rank decides which subject we specialize in. That discussion may appear to be very simple and enlightening for somebody who doesn't know, but when I have to repeat it multiple times, it just does get a tad irritating. So it might appear to be the least important reason, but trust me, it plays some role in the minds of some people at least. Reason number 3 why people prefer MD or MS to DNB is that the best postgraduate institutes in India, like All India Institute of Medical Sciences, PGI Chandigarh, JIPMER, NIMHANS, all of these places award MD or MS degree. So if you have made up your mind that you want to pursue post-graduation in an institute like AIMS, then you can't really go for DNB. By default, you are getting MD or MS. So that is also one of the reasons why many people automatically go for MD/MS without really spending too much time thinking about the advantages of DNB. Reason number 4. This is also something which people do think about, that if you have completed MD or MS, you have the option of adding the DNB qualification to your CV just by appearing in the DNB final exam. So if you are a successful MD/MS candidate, you have been granted the pass certificate, you are eligible to appear in the DNB final exam, and if you pass the DNB final exam, you get 2 qualifications instead of 1. You get an MD plus a DNB, or an MS plus a DNB if you have passed both exams. You don't have to go through the entire 3 years of DNB training. The reverse is not true. If you have passed DNB, you can't appear in the MD or MS final exam. So that is also an advantage that people are aware of, and why many people choose MD or MS over DNB. And the final point, in certain government colleges in certain parts of India, surgical residents get a lot of hands-on experience, and this is generally seen in a much greater capacity in government medical colleges, which generally award MD or MS degree. There are a few government medical colleges which award DNB degree, and some government medical colleges also have good hands-on experience for surgical residents pursuing DNB, but this is more widely seen in the case of MD or MS. So better surgical hands-on experience is also a key reason why people generally choose MD/MS over DNB. So if you want to pursue a surgical residency, and if you are really interested in having hands-on during post-graduation itself, then your research would point you towards a college which generally will offer MD or MS and not DNB. So these were the 5 points in favor of MD or MS. Now let's talk about the 5 points in favor of DNB. And then I'll allow you to decide on your own, but I'll also give you a very simple outline which you can use to sift through the various pros and cons and come to a decision that you will hopefully not regret later on. So let's talk about the 5 points in favor of DNB, why you should choose DNB over MD or MS. I believe the most important point in favor of DNB is that as of recording this video, there is no post-graduation bond in DNB. I have a separate video planned where I'll talk precisely about the pros and cons of post-graduation bond, but this is certainly something that I want to address here in briefly, that after DNB, at least as of recording this video, there is no provision of a post DNB bond, which means that after you get your degree, you can chart your own course. You are not going to be forced to work in a place that you may or may not want to work in. So that's certainly a very big advantage, because your career goes in the direction that you want it to go. There is no left turn or right turn that you are not comfortable with. The second point in favor of DNB over MD or MS is that to get a DNB degree, you have to pass an exam which is of a uniform standard all over India. It's conducted under the auspices of the National Board of Exams, and they maintain a strict quality control across India, which means that if you have to pass the exam, you have to study as well as the person studying in a very good college with a very good academic atmosphere. So your job is cut out. You cannot procrastinate, you cannot really read from books that are not going to be adequate to answer all the questions. So a relatively uniform standard of training is ensured in pursuing DNB. So a person who has the DNB degree, generally, I feel, this also boils over to point 3. Generally, a person with a DNB degree has more knowledge than a person with an MD/MS degree immediately after passing post-graduation. Because they have had to study that much more, they've had to put in that much more effort to pass the theory and practical exams of DNB. The fourth point that I want to hammer down here is that there is no difference between DNB and MD/MS in any practical terms. Everything that an MD/MS degree holder can do, a DNB degree holder can also do, and is also eligible to do. Many times candidates are not aware that MD/MS is absolutely equivalent to DNB, and they choose MD/MS just because they are not familiar with DNB. So I want to really emphasize that DNB is equivalent to MD/MS in all practical terms. There is absolutely no avenue that I can think of where DNB candidates are at a disadvantage compared to MD/MS. There was this perception, at least when I was pursuing post-graduation, that when it comes to being employed as a teacher in a medical college, MD/MS candidates had an edge. That is also no longer the case. In fact, as I record this video, the place where I work in, the head of the department has DNB. The most knowledgeable people in the college generally have DNB. The most successful doctor is also having DNB. So whether it comes to success in private practice or knowledge to enable you to be at the top of your game as a teacher, DNB is not something which is going to hold you back. In fact, in many cases, it might actually be an added advantage. So that certainly is a point in favor of DNB over MD or MS. And the final point favoring DNB over MD or MS, in my humble opinion, is that if you get to pursue DNB from a big reputed government medical college, then you get the best of both worlds. You get to do post-graduation and not have to serve a post-graduation bond, and you also get the advantage of having trained and studied in a government medical college, which has its own advantages, which I will talk about in a later video, where I'll compare post-graduation in private college with post-graduation in government college in a very balanced manner. So that was it. 5 points in favor of MD or MS over DNB and 5 points in favor of DNB over MD or MS. Now let's talk about the most important thing, how to decide whether to take MD or MS or DNB. Easy. First, decide which subject you want to specialize in. This is something nobody else can tell you. You have to figure this out on your own. Based on your own research, you want to specialize in a subject that you are going to be working in for the rest of your life. So be very serious about it. Understand what the ground reality of most specialists in that subject is. Don't just focus on a few successful people. Focus on the median lifestyle of most specialists and ask yourself if you are going to be happy with that lifestyle or not. If yes, then by all means pursue post-graduation in that subject. The next thing you should look at is also something which is going to stay with you for the rest of your life. That is the qualification. Is it MD, MS, or is it DNB? You have to understand that the subject that you wanted to specialize in, are you going to be able to specialize in with the help of MD, with the help of an MS, or with the help of a DNB? If it is possible with all three, then you have to move to the third criteria, which is the college or the institute from where you are going to specialize in. This is the most temporary of the three I have mentioned. No matter how good the institute is, you are going to stay in it only for 3 years. And in many good institutes, it's impossible to get back in it after you have completed post graduation because of the level of competition. So, once you figure out the subject, once you figure out whether MD or MS or DNB, then think about the best possible college where you will get the specialization in the subject of your choice. If you have to choose between a subject of your choice and a very ordinary college, and a subject that is not of your choice and a very good college, I would always urge you to choose subject over college, because subject, specialization, that degree, that tag of being a specialist in that subject stays with you for the rest of your life. The college stays with you only for 3 years. I hope by watching this video you could get a clear insight regarding how to choose between MD, MS or DNB. I hope you like this video.